Did you know that the very first minute of a stroke can decide whether you ever speak, walk, or even recognize your family again? That first minute often begins softly. A little fog in your thoughts, a heaviness in your arm, a strange tug in your speech, or a sudden shift in balance that makes the room feel uneven. These changes don't always feel dramatic. They feel subtle, almost easy to dismiss. And that's exactly why so many older adults here in the United States choose to wait, hoping the moment will pass. But your body isn't trying to frighten you. It's whispering, not shouting, giving you a chance to respond with calm instead of panic. If you're over 60, I want you to understand something important. You are not alone in this, and these sensations deserve your attention, not your fear. My name is Dr. James, a neurologist here in the United States, and for more than 20 years I've walked beside older adults through these confusing moments, in emergency rooms, stroke units, and quiet clinic conversations where worries often feel heavier than symptoms. I know how quickly doubt can silence your intuition. I know how easy it is to say, maybe I'm just tired. So today, I want to guide you gently, step by step, so you know exactly what is happening inside your brain during those first 60 seconds, and exactly what you can do to protect your independence. In this video, I'll show you 7 simple, life-saving actions you can take before help arrives. Actions every senior should remember, because they are far easier than you think. Before we continue, if you haven't subscribed yet, I kindly invite you to tap the subscribe button and turn on the little bell. It helps you stay connected to every health tip made especially for older adults, and it helps me reach you when information like this truly matters. And if you're ready to explore these steps with me, go ahead and comment the number 9 below. If something feels unclear, comment. Your feedback guides me and helps me support you better in every new video. And now, with that foundation in place, let's take the next step together. Because the very first action your body needs in those 60 seconds is simple, gentle, and fully within your control. In fact, it's more important than most people ever realize. 1. Sit down immediately. The greatest danger in the first 60 seconds of a stroke is not the stroke itself, it is the fall. When a stroke begins, your body can feel unsteady, and the smallest change in balance becomes a real threat. For many older adults, reduced circulation makes it harder for blood to support posture during sudden neurological stress. Your brain may lose orientation for a moment, creating a foggy feeling that makes your steps less certain. Age also slows natural reflexes, so your legs may not correct quickly when the world tilts even slightly. That is why sitting down immediately is a protective act, giving your body stability before symptoms progress further. By lowering yourself to the floor, a chair, or a wall, you reduce the risk of fractures and head injuries. Staying upright demands more work from your heart, forcing it to pump harder just to maintain blood flow upward. When you sit, your heart can redirect energy towards supplying your brain, which is already struggling for oxygen. This simple action can slow the cascade of complications, buying your brain time until emergency help arrives. Before we move on, let me share a brief example that shows how quickly balance can fail. Harold, a 74-year-old from Texas, felt only a slight pull in his arm before his knees gave way. Because he sat down quickly, he avoided a dangerous fall and prevented injuries that could have worsened his condition. If you ever feel sudden weakness, dizziness, or confusion, sitting down is the first and most essential response. Look for the nearest stable surface, a chair, a couch, or even the floor, and lower yourself carefully. Use your hands for support and move slowly, giving your body a moment to settle and regain steadiness. Once seated, stay still and let your breathing ease, allowing your heart to maintain steady circulation upward. This small adjustment protects your bones, your brain, and your overall safety while you wait for medical attention. It may feel simple, but it strengthens your chances of staying conscious and stable during those early critical moments. And as soon as you are safely seated, your next decision becomes even more important for protecting your brain. Because the step that follows can shape whether doctors have the information they need to save threatened tissue. 2. Call 911 and note the exact time. A single incorrect answer about when your symptoms began can close the door to life-saving treatment. When a stroke starts, every minute becomes a decision point, because modern stroke care depends on one critical detail: the exact moment your symptoms first appeared. This timestamp guides the entire emergency team, from the dispatcher to the paramedics to the neurologists waiting at the hospital. Without it, they cannot safely use time-sensitive treatments that dissolve or remove clots. For seniors, this small detail becomes a powerful act of protection. One clear, confident statement, "My symptoms started at 4:17, can determine whether doctors are able to rescue the part of the brain that is losing blood. And remembering that time is easier than most people think. You can check the nearest clock or glance at your phone. If someone is with you, say the time out loud so it is heard and remembered. If you are alone, open your phone and type the time into a note or record a short voice memo. These simple actions anchor the event so you can share it accurately with the emergency team. Before moving on, let me share a brief example that shows why this matters. Lorraine, a 69-year-old from Florida, felt her speech twist while preparing breakfast. She immediately looked at the microwave clock, repeated the time aloud, and called 911. Because she noted the moment clearly, her medical team acted quickly and provided the right treatment within the safe window. What you must never do is wait to see if it passes. Many seniors experience a temporary improvement called a TIA, which can disappear quickly. That improvement does not mean the danger is gone. It means a larger stroke may be approaching. Waiting at home during those fragile minutes puts your independence at risk and reduces the options available to doctors. Calling 911 immediately ensures trained professionals can evaluate you, protect you, and prepare the hospital before you arrive. As you stay on the phone, the dispatcher will guide you through questions, keep track of your symptoms, and help you remain calm. Their voice becomes a steady source of support while your brain manages the crisis. And once the call is made and the time is marked, there is another essential step your body needs, because posture can change how much oxygen your brain receives. 3. Lie flat on your back, supine position. One simple change in posture can help your brain receive more oxygen without any equipment at all. When a stroke begins, your brain struggles to move blood past the blockage. Even a small uphill push against gravity makes that job harder. Sitting or standing forces your heart to work extra, pumping blood upward to reach the brain. But lying flat creates a direct, level path, making it easier for oxygen-rich blood to travel where it is needed most. This position supports your circulation, reduces sudden drops in blood pressure, and helps your brain stay alert for as long as possible. If you are alone during those first moments, move slowly and use nearby furniture to support yourself. Lower one knee toward the ground, guide your body down gently, and let your shoulders touch the floor or bed first. Avoid twisting quickly. A controlled lowering keeps your balance steady and protects your neck, spine, and hips. Once you are flat, relax your jaw and shoulders, allowing your breathing to settle into a calmer rhythm. If someone is with you, they can help guide your movement. Ask them to support your arm or shoulder so you don't lose balance halfway down. A caregiver can place a pillow under your head or adjust your legs slightly to relieve tension. Their calm presence can make the transition smoother, especially if you feel lightheaded or unsure. Before we move forward, let me share a brief example that shows how valuable this position can be. Dennis, a 78-year-old from Ohio, felt sudden confusion while reading in his living room. His wife encouraged him to lie flat, and within seconds he felt steadier. That simple shift helped maintain his blood flow while they waited for emergency responders to arrive. Lying on your back is not about comfort. It is about helping your brain conserve energy and receive every bit of oxygen it can during a critical moment. This gentle posture can protect your awareness, your breathing, and your ability to respond to emergency instructions. And once you are safely lying down, there is another way to support your brain even further, because gravity can become one of your strongest allies when used correctly. 4. Elevate the legs. 10 to 12 inches. Gravity can become your quiet lifesaver during a stroke. When a stroke begins, your brain fights to receive enough oxygen. Lying flat helps, but gravity still pulls much of your blood into your legs, especially as circulation slows with age. Elevating your legs reverses that pull, allowing trapped blood to return toward your chest and heart. This increases central circulation and gives your heart a stronger supply to push upward toward your brain. Even a small lift creates meaningful improvement in blood flow during those early, fragile minutes. You don't need anything fancy to do this. A firm pillow, a folded blanket, or even a rolled jacket can support your legs. Slide the support under your calves, not your ankles, to avoid straining your knees. The goal is a gentle lift, about 10 to 12 inches, enough to encourage blood to move upward without creating discomfort. Avoid raising your legs too high, because excessive elevation can strain your lower back or make your breathing feel tight. A slight incline is all your body needs to work with gravity instead of against it. If someone is nearby, ask them to help you adjust slowly. They can steady your legs, place the cushion correctly, and make sure both sides are balanced. If you are alone, lift one leg at a time and position the pillow carefully. Move slowly and breathe steadily, allowing your body to settle into this new posture. Before we continue, let me share a brief example to show how powerful this step can be. Raymond, a 77-year-old from Colorado, felt sudden dizziness while watching television. He managed to lie flat and lift his legs with a firm cushion. Within moments, he felt clearer and more grounded. That simple adjustment gave his brain the extra support it needed while waiting for paramedics. This step is gentle but meaningful. By elevating your legs, you help your brain receive the best possible blood flow until professionals take over. It's a small action that works quietly in your favor. If you find these steps helpful, please like this video and share it with someone you care about. It may protect them when it matters most. And once blood begins moving back toward the center, another challenge appears. Because your brain still needs stable oxygen, and that stability begins with your breath. 5. Slow, controlled breathing, the 4-2-6 method. The way you breathe right now can protect your brain, or cause it to lose oxygen even faster. When a stroke begins, panic is a natural reaction. Your body senses something is wrong, and your nervous system responds by tightening your chest, quickening your breath, and increasing your heart rate. That reaction is designed for danger, but during a stroke, it makes things harder. A racing heart demands more oxygen even while your brain receives less. Fast, shallow breathing also traps tension in your chest, limiting how much air your lungs can actually pull in. Slow, controlled breathing helps reverse that chain reaction. The 4-2-6 method is gentle, simple, and especially helpful for older adults. Inhale through your nose for 4 seconds, hold that breath for 2 seconds, and release it slowly through your mouth for 6 seconds. The longer exhale tells your nervous system to relax, opening your blood vessels and reducing the adrenaline that makes your heart work too hard. This rhythm lowers the oxygen demand across your body, allowing more of the available oxygen to reach your brain. If you feel overwhelmed, place a hand on your chest to guide your pace. Let your shoulders drop and soften your jaw. These small adjustments make each breath smoother and more effective. If someone is with you, ask them to breathe alongside you. Matching their rhythm can help you stay calm and steady during those early minutes. Before moving on, let me share a brief example that shows how powerful this technique can be. Ellen, a 72-year-old from Oregon, felt her breath quicken as her arm grew heavy. Her daughter guided her into a slow 4-2-6 rhythm. Within moments, her pulse settled, her chest loosened, and she stayed conscious until help arrived. That simple breathing pattern helped preserve her clarity when it mattered most. This step may feel small, but its benefits are real. When your breathing steadies, your blood pressure stabilizes, your heart slows, and your brain receives a more reliable supply of oxygen. These changes help you stay aware, cooperative, and safe while waiting for medical support. If you've received something valuable from this step, please comment the number 9 so I know you're still with me and staying informed. And now, even with your breathing calmer, another challenge may be limiting your airflow, because sometimes a tight collar can make it harder to breathe than you realize. 6. Loosen tight clothing. A small adjustment at your collar can change how much oxygen your brain receives. During a stroke, your body works harder than usual just to maintain steady breathing. Many older adults don't realize how much tight clothing can interfere with this process. A snug collar, a stiff jacket, or a tight belt can restrict the natural expansion of your chest and diaphragm. When your lungs cannot open fully, the amount of air entering your body decreases. And when airflow decreases, the oxygen reaching your brain also declines, at a time when every bit of oxygen matters. Narrowing around the chest and neck becomes a hidden barrier for seniors, especially those with reduced lung capacity, heart conditions, or muscle stiffness. Even gentle pressure can make breathing feel shallow, causing your body to work harder for each breath. This added strain can raise your heart rate and increase oxygen demand, creating a cycle that makes symptoms feel worse. Loosening your clothing helps break that cycle. Unbutton the top button of your shirt. Ease your collar away from your neck. Adjust your belt or waistband so your abdomen has room to expand. If you're wearing a jacket or sweater, open it to reduce pressure around your chest. These small actions help your lungs open more comfortably, allowing deeper breaths with less effort. If someone is with you, ask them to help. They can gently adjust your clothing without causing you to twist or strain. Their calm assistance can make the moment feel safer and easier to manage, especially if you feel confused or weak. If you are alone, move slowly and make one adjustment at a time, keeping your breathing steady. Before we continue, let me share a brief example to illustrate why this matters. Franklin, a 70-year-old from North Carolina, felt his breath grow tight during the first moments of his stroke. His wife unbuttoned his collar and loosened his belt. Within seconds, his breathing eased, and he felt more relaxed until paramedics arrived. Loosening your clothes may seem simple, but its impact is meaningful. This gentle step helps stabilize your breathing, reduce pressure on your chest, and support better oxygen flow toward your brain during a fragile moment. And even with easier breathing, your body still needs to conserve energy for your brain, which leads us to the final step you must follow. 7. Remain completely still. Sometimes, during a stroke, the most important action is doing nothing at all. When your brain is already fighting for oxygen, even small movements can make the situation worse. Standing up, shifting your weight, or trying to walk can suddenly increase the workload on your heart. The moment you move, your muscles demand more oxygen. Your heart pumps harder to supply those muscles, pulling oxygen away from the brain, the organ that needs it most during a stroke. For older adults, this redirection happens quickly. Age naturally slows circulation and reflexes, making balance less reliable. A stroke magnifies those risks. Even if you believe you can stand, your legs may not respond the way you expect. A slight misstep can lead to a fall, and falls during a stroke often cause injuries that complicate recovery. Remaining completely still helps protect your strength and preserves oxygen for your brain. If you are alone, settle into the safest position you've already created, lying flat with your legs gently elevated. Keep your arms close to your body. Relax your neck and shoulders. Let your breathing follow the slow rhythm you established earlier. Avoid reaching for anything or attempting to adjust your surroundings. The goal is to reduce all unnecessary movement so your brain can conserve energy. If someone is nearby, ask them to stay close and reassure you. They can guide paramedics when they arrive, monitor your breathing, and help keep you steady. Their presence reduces your urge to move, especially if you feel anxious or disoriented. Encourage them to remain calm, speak slowly, and remind you to stay still. Before we continue, let me share a brief example that reflects how vital this step can be. Joan, a 75-year-old from Minnesota, felt the urge to get up and reach for her phone when her speech changed. Her neighbor encouraged her to stay still and kept her lying flat. That simple decision prevented her from falling and allowed paramedics to evaluate her safely. Stillness may seem passive, but it is a powerful form of protection. It keeps the body stable, conserves oxygen, and prevents injuries that can complicate treatment. By staying still, you give your brain the best chance to hold on until trained professionals take over. And when all 7 steps work together, you transform the most dangerous 60 seconds into the strongest shield of protection. You have now learned the 7 simple steps that protect your brain during the most critical minute of a stroke. Sit down immediately to prevent a dangerous fall. Call 911 and clearly note the exact time your symptoms began. Lie flat on your back so gravity no longer works against your circulation. Gently elevate your legs to bring more blood toward your heart and brain. Slow your breathing with the 4-2-6 pattern to steady your nerves and conserve oxygen. Loosen tight clothing so your chest and throat can expand with every breath. And finally, remain completely still, allowing your body to direct every available resource toward your brain. These steps may seem small, but together they form a powerful chain of protection. They help your brain stay alive, aware, and stable until medical professionals take over. And I want you to remember one thing clearly. You are not powerless in a stroke. You are not waiting in fear. You are taking action with calm, knowledge, and courage. You can protect yourself. You can save precious time. You can save your independence. As your doctor and guide, my goal is to give you confidence, not fear. When you understand what to do, you can respond with clarity instead of panic. I encourage you to teach these steps to your spouse, friends, neighbors, and family. Preparation is not worry. Preparation is love. and remembering these first 60 seconds may one day protect someone you care about deeply. Now, I'd like to hear from you. Please share one thing you learned today and plan to apply in your own life. If this video helped you in any way, comment the number 9. If not, comment 0 so I can improve for you. And before you go, don't forget to like, share, and subscribe to stay updated with the next videos in my stroke series.